Hello and welcome to the Curated Beauty Podcast. I'm Jessica Christie, CEO of Beauty Culture Med Spa and the founder of the new functional and regenerative business, Cultured Wellness. From my start as a physician assistant to now not only being a practitioner but leading my own businesses, I've been on a unique journey through health, beauty, and entrepreneurship. Join us as we explore everything from skincare secrets to leadership lessons. Whether you're passionate about beauty or striving to balance life's challenges, this is your space to connect, learn, and shine. Let's dive in. Hello and welcome back to the Curated Beauty Podcast. I'm your host, Jessica Christie. And today, I am not going to lie, I am grabbing a curious elixir and making a little faux cocktail because we are diving into discussing orgasms, vaginal health, libido, sexual dysfunction. And so, let me take a quick sip here. Okay, you might be thinking, Jessica, you are my one who I turn to for Botox and Sculptra, and I'm all about stimulating collagen there in my face and lip fillers on my face. But why are you suddenly discussing orgasms and vaginas? Well, stay with me. It's going to make sense, I promise. And you're no more surprised than I am. When I initially had heard about the treatment of vaginal rejuvenation non-surgically and utilizing potentially PRF or other modalities for really helping women in that realm of health, I just felt like it was out of my wheelhouse. Leave it to the OBGYNs. But we're going to dive into that a little bit too. And I want to kind of start with this quote from the iconic philosopher Ralph Waldo Emerson. And he once said that the scaffolding of love is sex and beauty. And that is really food for thought. There's a lot of philosophers out there and researchers that really turn to talking about women's sexuality and eroticism and all of those things. And I think that as a cultural norm, we're allowed to talk about those things from a male standpoint. But when we start to talk about women not having a high enough libido or shaming women for being hypersexual or all of those things that may fall under and funnel into this bucket of this concept, it's complex, guys. And I just want to break it down into the science realm and keep it real scientifical, but also let you in on how that really naturally integrates into the whole concept of relationships. I think also, let's look at not only sex, but did you know that the primary reason that females are placed into nursing homes is due to urinary incontinence? And because they're peeing on the floor, through dementia, low mobility, and other age-related challenges, families really can still tend to cope with those things. But once they start to see their loved ones experiencing incontinence, that's when it's like, oh, this is a little bit more intensive care is needed. And it's like, seems to be the defining factor that places women specifically into homes. And, for anyone who's had a loved one in some sort of long-term care facility, nursing home, when you walk into a nursing home, what does it smell like? Usually urine. And so it's not a surprise to me to stumble upon that stat. And between 10 to 20 million conservatively suffer from stress incontinence, especially post-childbirth, post-menopause. And additionally, a staggering 50 million women require assistance with various forms of sexual dysfunction, whether that's painful intercourse, lack of lubrication, lack of libido, or inability or difficulty achieving orgasm. This is all really complex issues, you guys. So let me take another sip before we keep going. By the way, these curious elixirs, this is not an ad, but I love them. They're non-alcoholic. They're like these craft cocktails. The one that I'm drinking is the number 6, and it's a coconut pineapple painkiller. So I'm literally having this midday, but it's not alcohol. It's just like literally without the wasted feeling, just giving you that chill. So I guess I, needed something to help me unwind. Some lemon balm. That's what's in here. Plus some aloe vera for a beauty boost. Yes, please. We're all about the rejuvenation when we're talking about this new business offshoot, which is Cultured Wellness. So we're now offering many different services and we're slowly rolling them out because, as you know, we like to perfect everything. And one of them that we have already rolled out and have partaken in is the whole concept of non-surgical vaginal rejuvenation using 100% natural treatments such as PRF. And when we talk about what is PRF, I really want to kind of hone in on that and give you guys the 411, because before we even talk about the specifics, I think it's really helpful to know what PRF is and then why do we use it in vaginal non-surgical rejuvenation. So PRF mainly is composed of platelets, and these are blood cells that are responsible for clotting. So when you skin your knee, when you get an injury and you have that serous fluid, that's really what PRP or PRF is. And they release growth factors, which play a really critical role in wound healing and tissue regeneration. We also see leukocytes, that's just a fancy word for white blood cells. And these cells have immune functions, and their presence in PRF can potentially contribute to antimicrobial activity and enhance the regenerative process. We also have fibrin matrix, which is the serving of the scaffolding or this fibrin mesh that's helping tissue regeneration by supporting the cell migration and creating this matrix for all these things to happen and all these cells to proliferate. So why is PRF used in this non-surgical vaginal rejuvenation? Well, PRF is autologous, meaning it's just, again, a fancy word for saying that we're using your own blood as the patient, and we're making it biocompatible. And it's a really natural method without the risk of allergic reactions or rejections to certain things. And growth factor release is happening to stimulate this regeneration and enhance collagen and elastin production. Yes, down there. And this can lead to improved vaginal tightness, structure, tone. We even talk about how with the PRF injections, we see this multipotent stem cell kind of not only target the fibroblast and the glandular tissue in the G-spot, but also contribute to bone growth and fat cells enlarging and multiplying. And all of that's going to equal health of the tissue. We also want to talk about improvement of blood flow. So these growth factors released by the PRF can enhance blood vessel formation, potentially leading to more improved blood flow in the vaginal area. And that's going to increase sensitivity and sensitization of the tissue. And then also blood flow is what ultimately helps us to have that muscle contraction and that release in an orgasm. Lubrication. Some women have reported an improved natural lubrication post-treatment, and I would say all women. This can be really beneficial for those experiencing vaginal dryness. And then urinary incontinence, which we talked about, this is going to really help strengthen the vaginal walls and the surrounding tissues and potentially reduce the symptoms of stress urinary incontinence, which is a really, really common problem, guys. And you're like, okay, cool. Where do I sign up? But gosh, what all patients ask is, what is my ask of this? Like, what is my downtime? Well, PRF injections in the vaginal region are really minimally invasive. It takes literally no time at all to perform the procedure, and it is a really short recovery period, if any at all. So it's a really preferable option for those seeking non-surgical treatments. And I will tell you that anyone who has these treatments, there is like this element of hypersexualization right after you get it because of where we're injecting it, what's happening in the body. And then this does trickle into the longevity, which is first of all, sustained release of these growth factors from PRF, but also long lasting because of the true regeneration of the tissue, which is going to give us those longer responses in terms of tighter vaginal tissue. We're going to see orgasms be more intense and that they are definitely more easily achieved, which is obviously a massive goal. So moving on to like, what the heck are we doing and how is this working and all of those good things. So when we do this procedure, we're going to talk about the actual procedure, and then I'm going to kind of give you some more thoughts on who could potentially be a good candidate for this. So the PRF is actually injected into the clitoris and the G-spot. And we can only see the tip of the clitoris when we're injecting, but the way that we do inject it, what a lot of people don't realize is that it's actually like 4 to 6 inches long. Okay. So it's like similar to a penis in terms of how the structure and maybe a little shorter in some cases, but it's similar to that. And the tissue of the actual clitoris is very similar to the tissue in the penis called the corpus cavernosum. And you actually can also do shots in the penis of PRF. There's, different trademark coined names, like Dr. Charles Runnels has a coined term and technique called the P shot. And it used to be 5 injection sites for a typical penile rejuvenation treatment plan, but now they've honed it down into 3. And So back to the female, when injected correctly for the female, the PRF is actually flowing backward, engorging the entire clitoris, even the parts that we can't see. And so that is why we see this immediate hypersexualization. It's making this very sensitive. It's kind of tightening that up naturally just from the pressure from the fluid. And so it's very interesting in terms of that initial hypersexual experience. Before we talk about what happens with that, let's also first talk about the other injection site, which is the G-spot. This thought, like there's actually this thought from Dr. Grothenberg, who the O-shot was named after, actually. And it's the thought that the urethra is actually the most erotic part in the woman's body. And Dr. Charles Reynolds talks about, he has a history of being an ER physician. A lot of people in the aesthetic space and the regenerative wellness space have tons of different backgrounds. And they're either ER doctors, internal medicine doctors, like so many different types of doctors. But the funny thing is, we don't see a ton of OBGYNs stepping into this space. I hope that we see a massive shift and change in that, but we'll talk about why that potentially could be too. But anyway, he talks about the urethra being this like hyperarousal place, and even back to his ER days where like women that had identified this, like they would introduce things into the urethra. That's where your pee comes out, and would actually get stuck or caught or like go backwards into the bladder. And this was because this was a thought of like intense sexual pleasure. And so like Dr. Grothenberg, always said there's the thought that like every inch of a woman is purposefully erotic in some way. And so there's the urethra. And when you press on the G-spot, which is right inside the vagina on the anterior wall, it puts pressure on the urethra. And this brings in the whole debate of female ejaculation. And this area, when injected with PRF, like it's around the Skene's glands, it's going to create healthier tissue that will create more pleasure with sexual activity and stimulation. And actually the prostate gland, so we talked about how the clitoris is similar to the penis, but the prostate gland in men is similar to this tissue in women. So it's going to make orgasms more powerful right from the start, right after treatment. But then as, again, like these multipotent cells grow new tissue 2 to 3 weeks later, as the fibroblasts are building more healthy glandular tissue, new bone, fat cells enlarging and multiplying, you're seeing this long-lasting rejuvenation effect. And, that, like I said, that hypersexuality turns into the tighter vagina, orgasms being better, longer, stronger, and more easily achieved. Okay, so I want to take a step back and talk about why are we doing this? Well, there honestly is a lot of research dollars allocated to men's or male sexual dysfunction. It's considered detrimental for males to suffer from low libido, sexual dysfunction, erectile dysfunction, and no one really bats an eye at low libido or anorgasmia for women. There is really little consideration for all those things. And there's a little bit for dyspareunia or painful sex, but the tissue is just kind of withering away. There's not a lot of effort put into the former argument of it being important for women to have a high sex drive and have good, effective, achievable orgasms. Now, most OBGYNs that I've encountered are really not familiar with this treatment. They don't know how to do it. There's a reservation to learn. There is a massive lack of them understanding bioidentical hormones. There's still so much mistruths out there about hormone therapy. I want to take a hot second to dispel that myth. So there was a paper that came out, and this is very interesting because, again, we talk about published papers, data, people saying this is what the data shows, blah, blah, blah. Well, you got to dissect a paper for the truth, and looking at abstracts, looking at the methodology, looking at the results, really looking at where this paper could be flawed, right? So this particular paper that came out that made women feel like hormone replacement therapy, for example, could increase the risk for cancer and cardiovascular events. Okay, who's going to want that? You're going to be like, I'll deal with my hot flashes. I'll deal with my low libido. No one talks about that. That's important to care about. So whatever. Well, the study is based off of women that were older, most of them former smokers, most of them obese. Hello, what are the risk factors for cancer and cardiovascular risk? Those are 2 of them, big ones, 3 big ones. And also the study was based off of Premarin, which stands for pregnant horse urine. So horses have over 30 different types of estrogen. Women postmenopause, we have 3 forms of estrogen. So when you're giving women estrogen postmenopause and you're contributing to this whole factor of like what creates sexual dysfunction and what decreases libido and all these things, when you're giving women all these different forms of estrogen that their body does not recognize, that is going to be a problem. And therefore, you're going to see issues with things that your body is just like going to not fire correctly. And so, of course, we're going to see other disease states enter. Also, the data was really statistically not significant, actually, between increased rates for cancer and cardiovascular health, but they manipulated it to make it look like it was like a 20-some% increase in risk, when really it was not statistically different. But then we're talking about actually bioidentical hormone replacement, which is the identical hormone from a plant. So it actually comes from yams, but it's an identical estrogen replacement post-menopause. You can't have estrogen replacement prior to menopause, but post-menopause, you can have this estrogen replacement if your labs and your past medical history and your intake matches that you need replacement. And then we obviously monitor it very, very carefully. I can't tell you how many OBGYNs I've encountered that like are just either getting on this train when this is their area of specialty, and also ones that are still continuing to spit the truth of this article that came out that showed that there was an increased risk. And so with critical thinking skills, I think some of them are starting to peel these issues back and starting to take a second look. But a lot of it is because these amazing people in the regenerative medicine space are like going gung-ho to really create the publications to increase the awareness. And they're like, wait, maybe there is something to this. So it's a team approach. You know, by Western medicine trade, we are not addressing this issue. There aren't a ton of publications on it because guess what? When things aren't covered by insurance, they aren't talked about very much, and especially not researched when it's a natural body product that we're injecting back into the body. There's not a lot of opportunity for generating a lot of money for the drug companies. So here, we're going to talk about it. Yes, it's great for orgasms and restoring libido. Hello, we all deserve all of this. And it's the basis for healthy relationships and connection. There's massively different orgasms. This is proven, massively different orgasms that take place with true connection. So can you imagine being able to be a tool and helping to establish deeper relationships in women and men just together? But also we have a duty to keep this area for women healthier for longevity and quality of life. So moving on from there, I just wanted to like make mention of the psychological component that happens with sex. I think so often there's this common effect of couples and men saying, I need sex to feel love and connection. And then women are like, well, I need all these other things in the security to feel like I can open up and be vulnerable and have a good sexual experience. So first of all, men or women are kind of different in a regard, but also there's the whole component of women being subject to maybe not being able to talk about these things as well, and men and women alike, but we're talking about women today. If a woman has a good sexual experience, she's going to look forward to have sex again. If she's frustrated, where there's an issue, it's going to create a psychological barrier to arousal. And this is going to create this negative feedback loop for arousal where there's anticipation of this negative. So hesitation, less able to experience all the good that should come from sex. And so it actually gets worse and worse and worse instead of getting better and better. But if you switch the script and you flip it and you make women have these amazing experiences with sex because we're able to restore even this non-surgical vaginal rejuvenation plus potentially the bioidentical hormones, you're actually going to have this positive feedback loop where they look more forward to sexual experiences because they're getting something out of it that they never thought they could before. So honestly, I'm just going to call it out. There's a call to action to schedule an appointment with our team. And if you're interested in rejuvenating any of these intimate areas, non-surgical vaginal rejuvenations, they range from $1,200 to $2,400. There's other additives that we can put with the PRF, and we can talk about those during a consultation. These can enhance the quality of the growth factors and the potential efficacy of the entire procedure. There's a little bit of an elevated cost with that. So that's why I gave you the range from $1,200 to $2,400. And then we also bundle it with the Sprayology Woman Power. This is going to really boost from a homeopathic standpoint female hormones and support that all those pathways. And then also for those interested, we provide comprehensive consultations on hormone therapies. We really talk about different options, and all of this is crucial for understanding the aging process and maintaining that balance and that desire for intimacy. So I just don't want you to let societal norms or lack of information hold you back. I want potential patients and potential providers to just open their minds up to investing in sexual health and by extension, your overall well-being. If you have any other questions, I highly recommend you reach out to us on Instagram. The handle is at B, just the letter B, Cultured Wellness, all one word, BCULTURED. WELLNESS. And let's chat. Thank you for joining me today on this journey, talking all about sexual wellness. Until next time, Jessica Christie signing off. And that's a wrap on another enriching episode of the Curated Beauty Podcast. If today's conversations resonated with you, I urge you to share it with someone you believe could benefit from it. Let's spread the beauty, knowledge, and empowerment far and wide. For more in-depth resources, information about who we are, or if you're interested in becoming a patient or training directly with me or one of my team, visit our website at beautyculturespa.com. Don't forget to stay connected with us on Instagram for all the latest updates, behind the scenes, and beauty wisdom. Follow us at beautyculture.medspa and at B Cultured Wellness. That's the letter B, Cultured Wellness. Thank you for being with us today. Keep curating your beauty both inside and out. Until next time.